Alrighty, it looks like we're all here. So I am going to begin. Good afternoon, and thank you for joining us today for this official announcement on the launch of the DetectNWT COVID-19 screening program. My name is Agata Gutkowska, and I'm a Senior Communications Advisor for Cabinet Communications for the GNWT, and I will also be your moderator for today. So before we begin, just a quick note, I kindly ask that all participants mute their microphones until called upon. And unless you're on the panel, please turn off your video as well. Providing remarks this afternoon will be Minister of Health and Social Services, Julie Green, Minister of Industry, Tourism and Investment, Caroline Wawzonek, and Registered Nurse for the NWT Health and Social Services Authority, Melissa Holzer. And then joining us as well, we have Mark Henry representing Copperhouse Eatery and Lounge, as well as Jason Brinson representing the Salvation Army. Both have piloted the DetectNWT program and will be available to answer some questions during the question period with media. As per usual with our virtual events, we will start with remarks from our speakers, and then we will open the floor to questions. I'll run through each media outlet one at a time, and I've posted the order of media in the chat there. So I'll run through each media outlet one at a time, and everyone will have the opportunity to ask at least one question and one follow-up. Before asking your question, I ask that you name the person you are directing your question to. And if you don't have a working microphone, please type your questions in the chat and I will read them out for you. So, and with that, let's begin. I'll turn the mic over to Minister Green to deliver her remarks.
Thank you very much, Agata, and good afternoon, everyone. I'm happy to be here with the Minister of ITI and Finance, Caroline Wawzonek, this afternoon to announce the launch of a new program that will add yet another layer of protection for NWT residents to help us emerge from the pandemic. The DetectNWT screening program will help businesses and nonprofits to welcome more people back comfortably and safely to their facilities. As we continue our fight against COVID-19, we need to reach for tools to stop the spread of the virus as early as possible. Last week, the CPHO announced an order that allows for larger gatherings indoors and out for people who have their proof of vaccine credential. Today, we turn our attention to the health and safety of businesses and nonprofits serving the public. Testing frontline staff in high traffic facilities twice a week is one way to monitor people who don't have any symptoms of COVID-19, but who are carrying the virus. In other words, they're asymptomatic. Much like the school screening pilot project that we launched yesterday, DetectNWT will enhance population screening by distributing free and easy to use COVID-19 rapid antigen tests to organizations accepted into the program. The Abbott PanBio tests are easy to use and provide results in just 15 minutes. In addition to providing the screening kits to participants, the DetectNWT program includes training that will assist applicants as they develop an effective surveillance program to detect cases early and limit the spread of COVID-19 in NWT communities. These measures will make our workplaces, communities, and territory safer. NTHSSA has worked closely with local businesses and organizations to pilot and refine this program before making it available more broadly. I'd like to give special thanks to Jason Brinson of the Salvation Army and Mark Henry of Copperhouse for participating in the pilot. I'm happy to announce we are now accepting applications for worksite screening. NWT businesses and organizations are invited to apply online at nthssa.ca. Both private and not-for-profit employers and service providers across all sectors can apply for the program to support COVID-19 screening programs in their facilities. If demand exceeds capacity, program intake will prioritize areas of the highest impact by focusing on services, businesses, and organizations that have the most frequent contact with the public. Thank you, and I'd now like to turn the floor to Minister Caroline Wawzonek.
Thank you very much, Minister Green. I am also very happy to be joining you here today, along with all of our guests, and good afternoon to everyone. As we all know, the COVID-19 pandemic has created significant challenges for small businesses across the territory, and it's been demanding an extraordinary level of creativity and determination from all of us. Whether you're offering curbside pickup or going to an online format for your services, or from staycation to the installations of protective barriers, almost all businesses in the Northwest Territories have had to adjust the way they operate and serve their customers. And for that reason, the DetectNWT has worked with the federal government and territorial partners to continue to deliver various supports that meet the evolving needs of our territory's businesses in these difficult times. One of these, for example, is the Support for Entrepreneurs and Economic Development Program, or better known as SEED, which is delivered through the Department of Industry, Tourism and Investment. And just as we've been asking the private sector to continue to pivot and to adapt, we have also been pivoting the eligibility criteria of SEED in an effort to respond to the changing needs created by the pandemic. SEED currently provides funding to help businesses pivot to new operating requirements, to adapt their structural safety measures, to pay for additional PPE, and to provide relief for some short-term financial challenges. The DetectNWT also continues to roll out a variety of other programs targeted at the tourism and hospitality sectors specifically. And today, with the NTHSSA's lead, once again, the DetectNWT is trying to support businesses in creative ways. As businesses focus on welcoming clients back through their doors, DetectNWT kits are yet another tool for them to use to provide a safe and secure working environment for their frontline staff, as well as the continued assurance to the larger DetectNWT community that they are prioritizing safety for all residents. We know that Northwest Territories businesses are the backbone of our economy and will play a crucial role in the territory's economic recovery from the effects of the COVID-19 pandemic. The DetectNWT will continue to support them as they continue to navigate the pandemic and help pave a way forward towards prosperity and innovation and diversity. So again, thank you for having me here today, and I will now have the pleasure of turning it over to Melissa Holzer, who's a registered nurse with NTHSSA and the team lead on this exciting innovation. Thank you.
Thank you, Minister Green and Wawzonek. As the DetectNWT program lead for the NTHSSA, I'm happy to be here today to tell you about this new service we will be offering to support businesses and organizations in becoming partners in COVID-19 detection in our communities. Throughout the pandemic, we know that everyone has worked hard to do their part in limiting the spread of COVID-19. This has included regular screening for symptoms, additional health measures in public groups to change the way we act to limit the chance of introduction and spread of COVID-19. All of these tools and behaviors that we have in place now are still important. I want to emphasize that we need to remain cautious and keep our layers of protection in place. DetectNWT adds a new layer with distribution of rapid antigen testing kits to employers and organizations so they can be empowered to run their own screening programs. We have worked closely with a few local businesses and organizations to implement this program as an early pilot. And I want to thank Mark and Jason for being here today to answer any questions about how they are putting this new program in place. This pilot period helped us refine our program, and we are now ready to open applications up across the Northwest Territories. We know that each business or organization may have different operations and unique needs. It is also clear that not all screening programs will be of the same scale, with various sizes of operations. In developing the program, we've provided the training materials that will be required to develop a program that fits the needs of the applicant, but also is robust enough to meet the requirements we believe are needed to make it effective. As with any new process, there will be a learning curve, and we will be providing support as programs are created and implemented. And over time, expect for those who access this service, it will become regular and routine. As we work through the applications, it is important to understand that we will be prioritizing them based on criteria with a specific focus on businesses or organizations that are involved with 4 sectors. Those sectors are organizations working directly with vulnerable populations, high contact public services, essential services, and sectors that support economic and social activities. Any interested parties can review the program materials and requirements that are now posted on our website on nthssa.ca. And we will be working to review applications and support the creation of screening programs in the Northwest Territories in the coming weeks. Thank you.
Thank you, Melissa, and thank you to everyone for your remarks. We'll now move on to the question period. Again, I remind you to please mute your mics until you are called upon, and please make sure to mute yourself again after you have asked your question. The order for questions will be as follows. We'll have first Mariah at CKLB, then Ethan at NNSL, then Emily at Cabin Radio, then April at CBC, then Thomas at Media Tenois, then Kevin at True North FM. And remember to direct your question to someone on the panel. Mariah, what's your question? Hi, Mariah, are you there? Okay, we'll skip over Mariah for now. What about Ethan at NNSL?
Ethan has a question in the chat, Agata.
Oh, thanks, Ali. Okay, so this one is for Julie Green. Regarding DetectNWT, perhaps it's too early to say, but can NWT residents assume that this will be in place in a permanent fashion?
Thank you for the question, Ethan. At this point, the program is open-ended. It is a preventative program. Rather than responding to an outbreak, it's trying to prevent an outbreak. So I can see it having some legs for a while.
Can you hear me? Hello, yes, can you hear me? Perfect, if you...
Sorry, Mariah, I just muted you. I think there's a delay on your end. Minister Green was just answering Ethan's question. Sorry about that, Minister. Please go ahead.
Yeah, where it's a prevention program, I hope it'll be in place for some time, but I don't have a specific timeline attached to it. Thank you.
Ethan, do you have a follow-up? I'm going to take that as a no, and we'll go back to Mariah now. Mariah, if you could now unmute yourself, and let's see if this works this time around. Do you have a question?
Thank you, everyone. Can you hear me now?
Yes. Awesome.
Yeah, I apologize for earlier. I'm just curious to know if someone can give me more description as to what exactly are in these kits.
I'm going to direct this question to Melissa, and then maybe perhaps bring it to Mark and Jason as well, since you have firsthand experience with the program. Melissa, go ahead.
Thank you. Yeah, so each kit contains 25 swabs. 2 are quality controls. They essentially look like a pregnancy test and a Q-tip. So you're swabbing your nose on each side with a Q-tip, putting it into an extraction tube, and then taking 5 drops onto the little testing cartridge. So each kit will contain 23 tests, and then they'll have 2 quality control swabs. Thank you.
Mark, it looks like you want to speak to this.
Yeah, do I seem eager? Yeah, so just to give you a visual on what Melissa was presenting, that is the end result, which is there. So it is like a pregnancy test. This person is showing that they are negative. If they were positive, the T would also have a line below it. So we've done 50 of these here at Copperhouse, and we've had 50 negatives. So it's a really progressive, I think the word that I keep hearing is it's progressive policy initiative to prevent an outbreak. And when Melissa approached us a week ago, we'd been closed for 5 weeks. And it was intuitive, the connection between this program and business continuity, which is, I think, the highest level of importance to us at this point. So the vaccine rollout, ensuring that our staff are vaccinated, as well as this is just another layer of confidence. So business continuity is the most important thing for us. And having this as a second layer of confidence. Speaking to our manager today, and I asked him preparing for this meeting why it was important to him. And what he said was that obviously internally it gives us confidence that we're not spreading to other staff, amongst staff. But what he said, which was really poignant to me, is that our guests trust us to ensure that they have a safe environment. And this is a second layer of precaution that we can have a high level of confidence. I think it's 96% accurate in pre-symptomatic. That gives us a ton of confidence that our serving staff who are interacting with our guests in close proximity are at a very low likelihood of spreading the virus to our guests. So business continuity, staying safe, these are the things that are important to us. And that's why we're really eager and happy to be part of this program.
Great, thank you, Mark. Jason, do you have anything to add to that?
Yeah, I would just say thank you for the opportunity to speak on this. And we too at Salvation Army have been part of this pilot program and excited about it. And it's again another layer of protection. Obviously, our staff encounter people in vulnerable populations every day, and so the risk is great in terms of passing and spreading COVID around our facility. And so we are very thankful to be partnering with the government on this program. Thank you.
Wonderful, thank you. All right, Mariah, do you have a follow-up?
No, that's all I have for now. Thank you.
All right, so moving on to Emily Blake at Cabin Radio. Hi, Emily.
Hi, yes, my question is, Mark mentioned a little bit about the accuracy of these tests. I'm curious how the accuracy of these particular tests compare to either the rapid tests or the lab tests at the testing center.
I'm going to direct this question to Melissa.
Thank you for the question. So this is a rapid antigen test right here. So the Abbott PanBio is a rapid antigen test. Rapid meaning that you get results in 15 minutes. The gold standard for lab testing, of course, is a PCR test. Anybody who is positive in a workplace will still require to present to a testing center to have that confirmatory test, which is the PCR test. Rapid antigen tests, their specificity rate is around 99%. Their sensitivity rate is between 50 and 90%. So we need an adequate level of viral shedding. So that's why we recommend with DetectNWT to be screening more than once a week. So best practice is 2 to 3 times per week with a minimum of 2 times per week in this program.
Emily, do you have a follow-up?
Yes, I'm curious about the origins of this program. Is this something that other jurisdictions in Canada or elsewhere have also been trying?
Yep, Minister Green, do you want to speak to this?
Yes, it is being used elsewhere and for the same reason. And I actually saw a video today produced by the government of Nova Scotia, which is a step-by-step guide about how to perform the test, so that, you know, that's part of the training that Melissa and her team use. So yes, we're not unique. We're following along with some other jurisdictions in the country, such as Nova Scotia. Thank you.
Thank you. Moving on to April from CBC. Hi, April.
Hi, thank you. This is a question, I think, to Minister Green. Minister, can you tell me, I guess I'm curious what the ultimate goal of the program is. Is it to help us to open our borders or to lift restrictions?
Yeah, thanks for that question. Our ultimate goal is to return to life as normal, or as normal as we can make it. And so that means preventing outbreaks. And that means early detection of people who may be asymptomatic, and encouraging people who have symptoms to get tested at their local health center or at the testing center if they live here in Yellowknife. And so this is all aimed at prevention. We want to get to a point where early detection of COVID prevents outbreaks, and then the kind of disruptions that we've just lived through here in Yellowknife, where schools are closed and businesses are closed and people are working from home. We would like to return to normal, and this is one of the ways that we can work towards that. Thank you.
April, do you have a follow-up?
I think I'm good for now. Thank you.
Alrighty, so moving on to Thomas at Media Tenois. Thomas?
Hi, good afternoon. I would only have one question. Would eventually those kits be available for general population, knowing that the test centers are might be far away from downtown, for example?
Minister Green, do you want to take this one?
I'll start, and then I'll ask Melissa to join in. So I am aware in other jurisdictions that tests are distributed free through pharmacies for people to use themselves to determine whether they have COVID. And so that would really depend on the supply of tests. We don't at this point have enough tests for widespread public distribution. We're really aiming at those high contact points in businesses like Mark's and nonprofits like Jason's. But for the longer term plan, I'll ask Melissa if she's got a sense of that. Thank you.
Thank you. I don't have information on hand right now as to when rapid antigen tests will be available to purchase over the counter in Canada. I do know that right now we have a healthy supply for this program specifically. So I'll push that to our comms team, and we can table that for now and perhaps get back to you with an answer. Thanks.
Thank you. Thomas, do you have anything else to add?
No, thank you very much.
Okay, great. So moving on now to Kevin. Kevin, I see that you've written your question here in the chat. So this one's to Minister Green. Do we know how many businesses have applied for the program and how many are expected to apply? I'm not sure if this one might be better for Melissa. What do you think? Yeah, Melissa, go ahead.
Yeah, so we have, I can't disclose the name of the businesses that have applied, but I can say that we have quite a few participants interested. So we are just prioritizing requests right now. Of course, we do have, Copperhouse and Salvation Army approved right now as our launch customers, and we'll know more in the coming weeks. And we can perhaps push that to comms and get an answer back to you again. Thanks.
Kevin, do you have any follow-ups? Okay, great. All right, so we have a little bit more time left, so I'm just going to run through the media outlets again and give you another opportunity to ask any questions. So going back, Ethan, do you have anything to ask? Okay. Mariah at CKLB. Mariah, are you there? All right, moving on to Emily Blake at Cabin Radio.
Yes, hi. I'm curious how many kits the territory either currently has or plans to have access to.
Melissa?
Yeah, so we plan to have access to a healthy supply. We plan to have access to around 30,000 tests. We have a healthy supply right now that's ready for distribution to interested participants. So right now we're sitting nicely with in terms of the amount of tests that we have available.
Emily, do you have a follow-up?
Yeah, it's more sort of a clarifying question. So my understanding is with the new separate vaccine passport program, that doesn't apply to employees, and this testing program is directed specifically at employees of businesses. Is that correct?
Minister Green, go ahead.
Yeah, thank you. So businesses can require their staff to be vaccinated. They can have their own local vaccine mandate. And of course, there are businesses that have that in place now, and the GNWT is moving towards that for the end of November. So that's one dimension of it. This is another dimension to see whether people are asymptomatic with COVID, and that's on the staff side. Then on the customer side is the proof of vaccine credential, where people can go into facilities in larger numbers by showing their proof of vaccine credential, and this also helps businesses to increase their capacity beyond the current gathering limits for people who are not using the passport system. So it's three interrelated programs that are aimed in the end at preventing COVID from spreading. Thank you.
Thank you, Minister. Moving on now to April at CBC. Do you have any more questions?
I do, thank you. This is, I think, probably best to direct it either to Jason or Mark. I'm curious, what kind of work do businesses or organizations have to do to implement these tests? Like logistically speaking, are there any, extra costs that you had to bear to put this in place?
Great, thank you. Yeah, I'll throw it to Jason, and then Mark, you'll have an opportunity as well to weigh in. Jason, go ahead.
Yeah, thank you for the question. We've added to, so the kits come from Health and Social Services, but we've added the required PPE to that, which also comes from them. So really there's minimal cost to us as an NGO to provide this service, which is really good. That is a great great help for us as an NGO. I can't speak for Mark and how they've rolled out there. I know that for us, we've put together a kit within a kit, so to speak. And so the people who are trained at the Salvation Army can then just take from the kit what they need and go to a location and set up and be able to perform the test and have everything that they need available, other than a few items that you might have to grab from the floor, for example, the garbage can or something like that. But in terms of the gowns and the face coverings, masks, gloves, the test kits themselves, everything is contained and into a kit. So really no extra costs in that way. Staff are already present on shift. We're not currently calling in extra staff to do the program. We're just using on-site staff. So it's been really, really good. Been very helpful. The partnership has been wonderful. The training was great. We were shown how to do everything. Any questions that we had were answered, and the resources that have been put together are great. Thank you.
Thank you, Jason. All right, Mark, go ahead.
Nothing really else to add other than just the glove. This is that we used to administer the test, and that was something that we had on site as previously in our normal operations. The other thing, as Jason indicated, just our time. Our processes over the last 3 test sessions have been streamlined, that we basically will take the staff in and it takes 30 seconds to a minute for us to administer the test. So there's really no impact on their productivity. And again, the real point of this is business continuity and giving us confidence in our operations. So it's well worth the investment.
Thank you, Mark. April, do you have any follow-up?
That's all from me. Thank you.
Great, thanks. Thomas, are you good, or do you have any additional questions?
No, I'm good. Thank you.
Okay, and Kevin. All right. So I guess this wraps things up. Thank you to Minister Green, Minister Wawzonek, Melissa Holzer, Mark Henry, and Jason Brinson for joining us today. And thank you to all members of the media for being here as well. Just a note, we did put out the news release at the start of this announcement. And if you have any further questions, please reach out to the Office of the Press Secretary at presssecretary@gov.nt.ca. Have a great afternoon, everyone.